Hi, my name is Laura, and again, my child has named me Princess Mommy. So I'm coming to you as Princess Mommy, and I want to talk to you about the difference between a nurse practitioner or a more medical approach versus a midwife. So my first pregnancy, I saw only midwives. I feel a little bit spoiled actually because the midwife attitude is just very, you can do this, your body knows what it's doing, we're going to roll with whatever happens. Yes, things can go wrong. Yes, there can be problems, but until we see indication of that, we're going to move accordingly as though you are a low-risk, healthy pregnancy. And, of course, things are monitored. You get your ultrasounds, and especially if you're seeing a nurse midwife, like in a hospital setting, you have the same kind of routine with testing and screenings, but it's just a different feel. It's a different environment. It's a different vibe in general of just kind of believing in you, in the woman, believing in the woman's body, and just knowing that you can birth this baby. Your body knows what it's doing, and you can birth this baby. Until proven otherwise, you can birth this baby. Okay, so this next pregnancy, I mentioned in my previous video that I definitely had a different experience for my first visit. Part of that is because I'm 34 this go around, but part of that is because I saw a nurse practitioner instead of a midwife. There were some scheduling issues, all on me, 100% on me, and I agreed to see the nurse midwife, and I didn't really think it would be that big of a deal, honestly. And let me just say, the nurse practitioner was lovely. I liked her. And if I was like worried that I had a hormonal imbalance or that I was sick or something, she would be fabulous. Like, she is on it. And that's what you want, when you're sick. But when you're pregnant, you don't necessarily need that same level of alertness that you do, if you're sick. So the nurse practitioner was very official, and she came in and she was very official, and she was, well, we really want to get you looked at by a specialist, and you really need to think about the genetic testing, and you're 34, and you really need to. It was just a different vibe, and it just felt like we were poised for disaster. I was a ticking time bomb, and at any moment things could go wrong. And were you screened for cystic fibrosis last time? Because we really need to think about that, and just all these things of what could go wrong, when it could go wrong, and how we could be prepared for the wrongness. And I wasn't anticipating that at all. And she, like I said, I liked her as a human being, as a provider. I liked her. I didn't feel unsafe. I didn't feel I didn't feel uncomfortable at all by any means. But I just felt kind of a lack of faith, I guess, in my body and in this process and in the whole thing. So fast forward to my next appointment, and I saw the midwife. And the minute she walked in, you can just feel the difference, because she walked in and she was like, hi, I'm so-and-so, and are you Laura? It's so nice to meet you. I've really been looking forward to it. How are you feeling? And then she just stops. How are you feeling? And I said, actually, feeling pretty good. Oh, wonderful. And she asked me all the questions you asked, but it's just it's not that, well, we really need to look at, just wasn't that, it was, okay, well, I see you had some bleeding last delivery. Well, we need, we'll think about that, and maybe we could try, a shot of Pitocin your leg before we even get to that point, and maybe that would be needed. We, just talk about that. And I said, okay, that sounds, like we can talk about that. you know, but it was just, it wasn't that sense of gloom and doom, I guess, that I felt before. So, I mean, I was really, I'm really glad that it was my second pregnancy so that I wasn't terrified. And I'm glad that I had that experience because I really had never had that medicalized feel before. So I felt like that was a good thing to go through. It was interesting. I didn't fully enjoy it. I mean, like I said, she wasn't a bad, please don't think that she was bad because she wasn't. It wasn't like that at all. It's just a different attitude. It was just a different attitude and I was not used to it. And, you know, I had a large baby the first round. So she was like, oh, I think you were diabetic last time and didn't get caught. I think we're going to need to do the 3-hour test this time no matter what. And I was like, I wasn't diabetic. My sugars were checked. I was over and over and I was fine. So anyways, you know, I talked to the midwife who I was with last time who will be delivering me this time. She was like, you were not diabetic. It was not missed. You grew a big baby. So, you know, it's just stuff like that where it's like, you know, of course, do I want a big baby? No. Did I want one last time? No. But do I think I can push out a big baby? Yeah, I've done it before. I pushed out 9 pounds, 10 ounces with no drugs and, you know, in about 20 minutes. And it was fine. I mean, I didn't enjoy it, but physiologically, there were no complications there. Do I think I can push out a 12-pound baby? Absolutely. Do I want to? Probably not. But do I think I can do it? Yeah, I really do. I really think I can. So, that if you're looking at a provider, even if you want a standard medical approach, that's fine. But if you feel like this person doesn't trust my body, this person's waiting for something to go wrong, if you have that feeling, maybe consider looking at a different provider. I know if it had been my first pregnancy, it would have really changed the nature of it. It would have changed my confidence level, and it just would have changed my birth. And I feel so fortunate that my birth was no intervention and just as smooth, physiologically smooth as possible, and fully supported, and a lovely environment. The lights were low, and it was nice. It really was. I felt very safe the entire time. I felt safe. I felt protected. I felt respected, and I was never afraid during that entire experience. So that's what I would love for every woman to have, whether it's with a midwife or an OBGYN, or whatever your preference is, your obstetrician. But I'd love for you to explore your options and just be with somebody who has faith in the birthing process, is not afraid of it, and has faith in your body as a woman, because we can do some pretty incredible things.